Patients will come here sometimes with a constellation of symptoms. They can come in here with the stress associated with that and anxiety. And I like to call it the pain, stress, anxiety complex. It's kind of, you can't really have one without the other, so to speak. It all sort of just falls into place. So the other question that patients may have is, okay, how do you know how much pain I have? And how do you know exactly what I'm experiencing? And the answer to that is we don't always necessarily know precisely what you're experiencing. We know what you tell us, and we examine you, and we do these things to try to understand it. But there may be some tools that help us see what the effects of pain are on the body. And one of the tests that I do that's recently come into play is called an eVox test. The eVox is a cutting-edge technology that utilizes a way to map the brain. And without getting too detailed into the explanation, the brain map really gives us an idea of where electrical activity is firing away at a very fast pace. And we see this, quite frankly, with patients who are overwhelmed with stress, overwhelmed with multiple medical problems, multiple psychological problems, and the combination thereof, and how it can appear to affect the brain. There are studies on this that have looked at specific syndromes and how the electrical activity changes in certain parts of the brain. So this eVox test provides a map, ultimately, of, well, how much stress is really affecting the brain, and then could it be that the problems with cognition develop? For example, reduced attention to a task, learning and memory problems, being able to retrieve information in order to be able to register it and then sync it in for a permanent memory, is not always an easy thing to do if you have reduced attention to a task in the first place. And that can be affected by this electrical noise that occurs in the brain, and we can see that part. So when you really look at how does pain, for example, or a stressful neurological condition affect the patient, we are really looking at how is it affecting the mind, how is it affecting the patient's nervous system. And this test is a great tool because we can visually see areas that are potentially problematic. And the beauty behind that is we can illustrate this back to the patient as kind of biofeedback to say, hey, look, in this part of the brain, we're consistently seeing a lot of electrical noise. And that's probably why it's interfering with your ability to be attentive, being able to form memories, being able to multitask, executive function, and so forth and so on. And this, I believe, serves as a mechanism, an accountability almost, where you can target the problem with something called neurofeedback. The eVox technology has a method to where we can institute a treatment that does not require needles, doesn't require scalpels, it doesn't require medications that can produce side effects. This is a technology where the patient is helping themselves and ultimately able to settle down that electrical noise in that part of the brain to neutral. And oftentimes patients will discover that they're more clear, that they feel better, that their pain is not as significant, and that overall their quality of life is much better. So the eVox test here, I feel like, is one of the most unique tools that we have, apart from most neurology clinics in the area. It's becoming a cutting edge way of looking at the effects of neurological conditions and pain and how it affects the brain.